Hey everybody, welcome to tonight's COCA session celebrating COVID-free camp. Thanks for joining us. I'm very excited for you to hear from my friends Ryan, Chris, and Melissa tonight to tell you how they pulled it off this summer, having in-person programs COVID-free. I'm Jennifer Amundsen, and I appreciate you being here. Please turn on your screen so we can see your smiling faces, and make sure you put your questions in the chat, and we will get rolling here. Ryan is going to present first. Ryan is with Happiness is Camping in New Jersey, and then we have Chris out in Utah with Camp Hobie. And then Melissa will wrap us up from Rappahoe, Alabama, down in Mobile. So Ryan, take it away. And I am going to turn off my screen for you.
Perfect, thank you.
Hopefully. Here we go.
All right. Okay, can everyone see that? Perfect. All right, everyone. So as Jen said, my name is Ryan. I'm from Happiness is Camping in New Jersey. So this summer we offered 26 days of overnight camp. We had one 15-day session and one 11-day session. We did 3 days of family camp, 14 days of staff training, 14 days of rental groups, and we just had our 40th reunion on Saturday with 80 people here, and we had 0 cases of COVID all summer. So when I was thinking about really how to boil down what we did, since we had 25 pages worth of protocols, the mantra that I came up with that really sums up what we did is keep it out, keep it in, and kill it. So keep it out is obviously keeping it off camp. Keep it in is our spread mitigation and prevention if it was on camp, and kill it is how we cleaned camp all year. So this is everything we did, and this is what I'll go into detail. So first and foremost, the most important thing that we did was we kept it out of camp all summer, which we didn't actually have to do the steps 2 or 3, which was lucky. But so keeping it out, the most important thing that we did all year, without a doubt, was our testing. It was without a doubt the most work. It was the most stressful part of our entire program. So we used an outside company called Diligent Urgent Care that did all of our testing. It cost us $1,000, and then they billed all of our campers and all of our staff members insurance. And from what we've heard, nobody's had to pay anything out of pocket because it was all sponsored by the CARES Act. So the state of New Jersey required some testing for unvaccinated people, but to make it easy and to do the safest route, we did all the same testing for everyone regardless of their vaccination status. So the state of New Jersey required everyone to have a negative PCR test taken within 72 hours before arriving. Again, they only required that for unvaccinated people, but we required it for everyone. And it worked out well. Most people went to pharmacies or urgent cares or their doctors and got the results in time. We only had one issue where a mom had to threaten a lab, and she got her results as she pulled into camp. Then everybody got a rapid test as they arrived. So they got out of the car, went over to the testing company Diligent, and they were tested right there. Once they were negative, then they can go through the check-in process. And then Diligent came back on day 4 of each session to do more PCR tests. And another big thing that we did is our counselors screened our kids every single morning before breakfast. They wrote down any symptoms that the kids said they had. And then the infirmary and our medical staff determined if we should do rapid testing. So what we found is like the same 7 kids just were sick all year long and had the same symptoms, and that's just who they were. Only once did we have an entire cabin screen themselves. We rapid tested everybody. They were negative, thank God. But that was definitely, it was nice. It gave us peace of mind throughout the year to keep doing touch points. Then the other thing that we did was vaccination. So all staff, volunteers, and medical staff were required to be fully vaccinated before they arrived to camp. And believe it or not, the only adult who wasn't vaccinated that came the entire year was the woman that the testing company sent to test all of our kids and get in their face. She wasn't vaccinated, and the day before she arrived to our camp, she tested 5 positive kids at a different camp. So that our medical staff pushed her to the side and did the testing for her, and she just stood 50 feet away and watched us. And then we didn't require our campers to be vaccinated. We strongly encouraged it, and I would say about 60% of eligible kids were vaccinated. Quarantining the staff was really important for us. So our staff arrived on June 19th for staff training, and then they never went home until August 1st once camp was over. And that just eliminated some risk, even though they were fully vaccinated. It gave us a little peace of mind that they wouldn't be going out and partying and everything. And it really made a sense that camp was home, and there was a lot of camaraderie on our staff. So that was really good for us. We encouraged campers to quarantine before arriving. One family went to Disney World and then decided to cancel their kid out of safety. But then we had a whole bunch of other families that, you know, went to camp and didn't do it. So out of all the keep it out strategies, quarantining the campers was the least important because some families listened, some families didn't. So again, I mentioned that we never had a positive test. A lot of camps in our area, a lot of camps that are in our town had positive tests. So we felt really fortunate there. We had a really good community buy-in, and that was really important for this keep it in strategy. So this was, if somebody did test positive, how do we mitigate and try to keep it from spreading out to the camp as a larger whole? How do we prevent an outbreak? The number one important thing that we did with that was cohorting. So in a traditional year, all of our kids, they have free choice. They're all over camp with everybody. And this year, they only participated as a cabin cohort in every activity. So we thought that this would change our culture the most. And I think it actually gave a boost to our culture because the kids had better friendships at the end of this summer than they ever have before. There was no complaints, and color wars is always a huge deal at our camp. So I was worried about eliminating that. We did cabin wars instead, and I'll never do color wars again because the kids loved cabin wars, and the cabins just rallied around each other so much. It was incredible. So our max cohort size was 10 kids, 2 counselors, but most only had around 7 to 8 campers in each. And when I tell you that cabins were never, ever, ever within 6 feet of each other for longer than a minute. So that was just in passing. The campers were really good about it. Even if they had a sibling, they would stand 6 feet away from each other with masks on and talk to each other. And that was really lucky because our rental groups and cohorting, they did not do it at all. And it was very stressful having the rental groups here. The other thing that I was very appreciative of this year was masking. So the state required this level, we required this level, and our campers took it all the way to this level. Everybody on camp masked way more than we asked them to. So they wore masks at all times except if they were eating, swimming, in their cabin, or when they were totally alone with their cohort. So when I say totally alone, I mean they were 50 feet away from every other cabin, and there was no chance of anybody ever mixing. But even if they were going to a different activity and they had the possibility of passing somebody, they wore masks. When we ate outdoors, they were 6 feet apart. They wore masks until they got their food. And that really helped us a lot, and it gave us a lot of peace of mind. So you see in that top right picture there, those are our oldest boys and oldest girls having a meeting with each other, and they're still 15 to 20 feet apart, and everybody's wearing masks. And we never asked them to. That's just something that they did, and I certainly wasn't going to ask them to do otherwise once they started doing it that way. So bubbling, as I mentioned, the staff stayed on camp the entire time. Deliveries were limited and they were monitored. So even delivery drivers had to wear masks. The chef had to wear a mask, and we gave them their own separate door where they were never close to any kids during deliveries. We had one designated bubble breaker who would go get supplies in town, or she would go deliver blood work to the hospital. And she, for the most part, stayed away from the kids. And if she interacted with kids, she went overboard. She wore an N95 mask and a face shield. When she went out in public, she wore an N95 and a face shield. And she was fully vaccinated as well. So she was bringing that over the top. And parents never entered our site, and I will never bring it back any other way. They dropped their kids off, the kids went through the entire process, and as soon as the kid was done, they just kept driving out. And on check-out day, the kids brought their stuff to the car, and the parents just kept going around the loop, and it was the best thing in the world. I will never change that again. So real quick, some other considerations. We really focused on outdoor activities. The number one thing we did was eat outside, and we had this huge party tent, and I think we ate all but 3 meals outside for the entire summer because of weather. And we already ordered the tent for next year because that's going to become part of our program moving forward regularly. We limited share supplies, which wasn't really that big of a deal. It was just another layer of Swiss cheese on all of the other precautions. But the bottom right, the outdoor medical triaging is something that our medical staff absolutely love, and they said they're going to keep forever as well. So if it's your typical camp injuries, or if they were screening for COVID or anything like that, they did everything on our health center porch right there. And if it was anything above and beyond, the kids were brought inside. I think we only had about 3 kids that were brought inside. 1 had strep throat, and the other 2 needed to get chemotherapy. So other than that, they were able to do everything outdoors right there. And then we also spent $80,000 and added extra airflow to all of our buildings to just keep fresh air pumping in and out of the buildings all day long. So finally, our last step was to kill it if it was on camp. So we deep cleaned cabins every single day, which is a normal thing, but this year it was intensified. So they cleaned cabins for 50 minutes this year. In a normal year, it's only for 30 minutes. We disinfected the entire site twice a day. So we used vinyl oxide, which I highly recommend. It is fairly cheap. And we found that actually ACA sent that because it was approved by the CDC to kill COVID. And I disparaged the use of an electrostatic sprayer one time when I was presenting. It looks like a Terminator gun. It was actually my favorite thing to use all year long. I disinfected all of camp in about 15 minutes with it. So I definitely recommend getting that. It was awesome. But the maintenance director disinfected all the high touch points each morning or each afternoon. And then I did it each night. One really good thing that we added that was kind of like an audible once we saw how camp is going, we added these COVID carriers. And I think that's a big thing. You're going to have a plan going into the summer, and that plan is going to change 100 times. You just need to be able to adapt as you go along. So a COVID carrier was a backpack that had vinyl oxide, Lysol, disinfectant wipes, hand sanitizer, and masks that each cabin used. So even though we were disinfecting the entire site twice a day, as soon as the cabin was leaving an activity area, their counselors disinfected the entire area too. So the Gaga pit was getting disinfected 6 times a day, the playground 6 times a day, the pool 6 times a day. And the counselors were really, really good at that. And that was something that definitely helped us. And I think moving forward, we're going to be doing something similar, not as intense, but something similar in a traditional year. And then frequent hand washing. Of course, we've all been in this pandemic long enough to know how important hand washing is. We closed our public restrooms, 1, because we were short-staffed and didn't have anyone who can clean all of them every day. But 2, also to kind of limit the mixing possibility and touching frequent surfaces. So after each activity, the cohorts would go back to their cabins and they would wash their hands, use the restrooms. And then you see there in that picture, we had hand sanitizer in every single door at camp. So just to wrap it up, it was by far and away my favorite summer of my entire life. And I've lived at camp all 29 years. It was the most meaningful program we've ever hosted. Our community had so much buy-in. The kids had so much buy-in. They were actually really looking out for each other more than I've ever seen in my entire life. I had one camper explain to his little brother who wasn't wearing his mask why it's important to look out for everybody else in his cabin. So I was kind of worried about how it would change our culture. And I think this year strengthened our culture more than any other year before. And it was just really awesome to see. Our parents needed it, our families needed it, the kids needed it, our staff needed it. So we feel really lucky, really fortunate, and glad that we hosted camp this year. So
wow.
Without further ado, I'll give it up to Chris.
Yeah, I'm going to let you answer these questions real quick, Ryan, that are in the chat. There are several in there for you. If you don't mind, real quick before we move on. One was, how many people, either staff or volunteers, worked on or were a part of the Keep It Out strategy?
So I did everything alone this year. I did all the Keep It Out strategy by myself, and that probably took up like 30 hours a week, just dealing with our testing company.
Okay. Did you alter your max capacity to keep your cohorts small?
We did, but very, like, it was almost negligible. I would say we cut it down to about 85% occupancy. And we originally thought it was going to be lower than 75, and we just kept adding kids the more comfortable we felt, closer we got.
And how did you, or did you at all have all camp messages?
So we normally have a big rec hall building where we do most of our activities, but we have a big patio area that we had the dining tent, and that's where we ate. And that really became our rec center for the entire year. So they sat at their tables that they sat at lunch. All the tables were 6 feet apart. All the kids still wore their masks, and that became, you know, the entire camp together in a safe way. And that's where we did everything. And also, to answer Deborah's question, we had a heat wave the first session, and it was 97 degrees the entire first session of camp. And the entire second session of camp, it was 75 and sunny every day. So it worked out.
Nice. All right, that's awesome. Any other questions for Ryan? Please jump in, turn on your mic. Okay.
Ryan, is it fair to ask, how many of the changes that you put in place this year will you carry over as just part of your normal camp?
Don, are you just setting me up for my presentation at COCA-I in November? Because that's what I'll be talking about a lot, way more than I would have ever imagined. This year was an opportunity to totally reset the program, and a lot of great new policies came out of it.
Cool.
Ryan, I have a question about your family camp, because actually I'm going to be doing mine in a couple of weeks. So you gave a pretty good rosy picture of everything. Was your family camp, everyone was just as compliant and mask wearing and et cetera, et cetera?
So Bev, to be completely honest, we didn't give a second thought to family camp. We thought that, oh, they're in natural cohorts, it'll be easy. Family camp was 10 times harder than our traditional camp was, because we had so many parents pushing back, and they didn't want to do masking. We got made fun of for maintaining these protocols during family camp. So it was stressful, and the parents were like, go play over there, and the kids didn't have masks on and everything else. So once we had more control over our residential camp, it was 10 times easier.
Yeah, I think I have about 75% vaccination rate in my parents. So yeah.
We had a large population that was notoriously protesting everything in New York City, and, you know, cutting locks off of playgrounds and everything. So it was difficult, and I never thought in a million years that it would be harder than resident camp, but it was definitely.
Okay.
Good luck.
Thanks. Thanks, Ryan.
Thanks. I'm really looking forward to it.
Oh, it'll be great, Beverly. Okay, Chris, moving on to you. Tell us how you did it. I feel like we should be shooting off fireworks, because you guys have just made just huge, it's amazing. I'm so proud of you.
Well, thank you for that. And I mean, I have to say that, you know, you guys are gonna get a little bit of repetition here, because Ryan actually helped us develop our protocols. We also work very closely with Primary Children's. So at Camp Hobie, we run programs for kids with cancer and similar disorders and their siblings. And I would say probably 95 to 99% of our campers are cancer patients, with a small percentage being other disorders that are treated similarly. We usually have 3 camp sessions. So we have a day camp for kids, day camp and Hobie juniors for 4 to 6 years, that's kind of a hybrid program. Usually it's 2 days of day camp where they come and go home at night. And then the Hobie Juniors is the same 2 days, but they stay overnight one night. So they get practice. Kids Week for ages 7 to 11, that's a 5-day, 4-night resident camp session. Teen Week for ages 12 to 19, same thing, 5 days, 4 nights. And for each session, the staff arrive 1 day before the campers to set up and do their training. So our program's a little bit, our overall season is much shorter than Ryan's. It's about 2.5 weeks. And we usually run early part of June, so middle 2 weeks kind of. So kind of our journey, I'll share that with you. So mid-February, you know, when we realized in January that COVID wasn't over and we were still gonna have to think about it this year, in mid-February, we reached out and surveyed our camper families to find out what their comfort level was with in-person camp versus virtual, what precautions they were willing to take for COVID. And that kind of helped us sort of set the framework for how we were gonna do things and what could be possible. We set a deadline of end of February to make a decision on whether we were gonna have in-person or virtual camp. That got delayed a month due to the this strange situation, which is volatile, uncertain, changing, and I don't know what the A stands for, but awful. We'll just call it awful because it changed every day, right? And it still does that. The negative was that we did lose some volunteer applicants who chose not to apply or interview because that deadline was put off and we didn't know. The positive was that that month gave us additional time to better map out how to stay safer. In mid-March, we surveyed our potential volunteers, basically the same kinds of things we asked the families, but we realized we needed to have their feedback too. And then we had held a town hall with our camp staff and planning committee to kind of talk through the considerations with them. Our final decision was made March 26th. And at that time, we decided we were gonna do in-person as well as offer a virtual component. It seemed like the better way to go. So our guiding principle for the whole thing was we followed expert guidance at a minimum, and sometimes we were more strict. As you guys have seen, a lot of these things changed like every couple of weeks. CDC had new guidelines coming out. ACA, their field guide was updated, so the emphasis on cleaning and surface transmission kind of went away before, kind of early on our planning stage. State and local government, and then we worked very, very closely with primary children's, especially the infectious disease department. And I know that Jamie Seal's on this talk today. So Jamie's the gold, Jamie, we couldn't have done it without her. So I might cry a little bit, but Jamie deserves much, much, much of the credit for this happening. So this is my map of what I had of all the things I had to do. I stuck a big sticky note on my wall and I jotted down all the things and I put who was doing it, or, you know, if it had happened and what we needed to figure out and all these different things that had to go together for camp. And I kind of ordered it by first, second, third, fourth, all that. This will be in the slides, so you guys will be able to see it later if you want to see my obsessiveness and my doodling. There was a lot of pre-camp planning that went into it. We had to go back and revise our budget. You know, Ryan touched on that they had additional funds that they had to allocate. That was huge. We put together a COVID-19 operational strategy and practices. So that was what we would do as an organization and then what we were asking our community to do. So our campers, our families, the staff and volunteers, even the program visitors and the campsite owners for where the lease. We put together go, no-go criteria, and we focused a lot on this. We had, and I think I've got more on that in a bit. We had a COVID-19 liability waiver where people had to sign and say, yes, they could get COVID, and yes, they were going to read the COVID policies and follow them. And if they didn't, it could be grounds for kicking them out of camp. We had to figure out COVID-related supplies, including the testing services that Ryan mentioned. And then we had program changes. So there was several different parts to this. The most important things, if I had to flag it out for anyone else that's going to do this, I think the go, no-go criteria for in-person camp were really, really important. Until we really had that mapped in our heads, I personally wasn't going to feel comfortable with moving forward unless we knew, like, yes, we can do this safely, or this is going to show us that it's not safe anymore. So we had key cut points with dates on them. We had staffing level. Like we have to be able to get enough lifeguards, we have to be able to get enough medical staff, we have to have the testing arranged. Our case counts in our community have to be below a certain threshold. We have to have a certain level of staff immunity. So staff that were 16 or over had to be we had 80% threshold for either being vaccinated or having recent infection. So within 3 months, and the med staff track that. So we reassessed that constantly. And then a lot of this was between Jamie and I, and because the medical stuff wasn't something that we were going to share outside of that group. And then celebrating wins. We have texts that went around where we, send each other happy emojis and things like that. And then the second big piece is just communicating so much and so often. We sent messages out about the protocols and the planning by text, by email. We had a social media campaign on our Facebook and Instagram. We had a town hall with the families. We had a separate town hall with the hospital where the oncologist asked us questions. And then we had a lot of COVID-19 info that parents got before and staff got before camp, in addition to the usual pre-camp info. We created the camp bubble. So Ryan mentioned that too. It's the NBA bubble, but camp. So it's way better. So all of our we really kept the focus on the most important thing to do to make camp happen was to have this bubble ahead of time. So everything this spring was virtual. Interviews, training, meetings. We didn't offer any in-person family programs this spring. We considered it, but we felt that getting people together, the vendor, we were going to go to a rugby game. And when we reached out to the vendor initially, they were going to have distancing in place and require masks. When it got closer to the date for the event, they had stopped all that. And we're like, we can't ask our families to do this when we're trying to focus on getting to in-person camp. Our day camp program, instead of having those kids come 2 days and go home in the middle, we cut it to 1 day so that they weren't going, leaving, and then coming back. And then, as I mentioned earlier, we had a virtual camp program. So if people weren't up to in-person or didn't want to follow the COVID strategies, they could go to virtual camp and participate that way. That also gave us the option of, because we planned out activities and programs for virtual camp, if at any time we didn't meet our go, no-go criteria, we could we could more easily pivot to offering virtual for everybody. So that was very intentional piece of planning that we did. Again, limiting pre-camp exposure was big. As Ryan said, keep it out. So we looked at all the things that we could do or others could do. We talked about staff immunity. That was one of our cut points. And that was a really stressful part, is really trying to work on people. Our staff were used to filling out their forms the night before camp and, taking their time on that sort of thing. And we really needed them to have their medical forms in and completed well before camp so that we could make that final call. That took a lot of work on Jamie's part to track that down and make sure that we had information for people and that we actually met those thresholds. At one point, we knew that we had 2 sessions that were meeting the 80% criteria, and we had 1 session that wasn't. And that was, I lost sleep over that, because that would have been really heartbreaking to tell one of my program directors that they couldn't have in-person camp and the other 2 sessions could. We encouraged our community to follow masking and social distancing throughout the spring. And that was kind of the focus of a lot of the social media campaigns, was telling people things they could do to stay safe. We encouraged vaccination for everyone that was eligible. Our legal counsel and our legal people said that we couldn't require it at the time because of the emergency use authorization. We asked people to do a voluntary mini quarantine for 14 days before camp. And, we're like, don't go to concerts, don't travel out of the country. We know that not everybody did that. We know that we had people flying in from out of the country in Hawaii, and that's, voluntary, whatever. Testing, surveillance were a big part of it. We actually partnered with the Utah Department of Health. We did scope out commercial vendors, and we didn't have a lot of success in finding someone that was, I think the first one we talked to would have cost us $80,000 just for the testing services. So we found out through our local ACA chapter that the Department of Health here was providing free COVID-19 testing. So they actually did, I would say 95% of our testing. We required a negative PCR test 7 to 10 days before arrival. And that was for both staff and for campers, and whether they were vaccinated or not vaccinated. We also required people to have a negative antigen test within 24 hours before arrival. And the Department of Health actually was on site during camper check-in, and they did the camper antigen tests. And then the medical director and the medical staff tracked the testing status. So the first thing people did when they got to camp was go see Jamie and see if you are on the good list or the bad list for your test. We had one staff member out of, I would say about 170 staff or volunteers, one staff member that didn't come to camp because of a positive test. And we had one camper family that, as they drove in to check in, 2 of the kids in the family tested positive. So everyone in the car had to go home, and they went to virtual camp. The nice thing was there was no cost to the organization, our families, or staff. We did have a few staff out of state that had to go through other vendors, and I think a few people did pay their testing fees, but it was still minimal. Oh, sorry, see, next slide. So we did arrange for a commercial vendor for test purchase. I think we didn't end up using it. Even the out-of-state people either found a local place to work with or got it covered with some other way. We licensed our on-site infirmary as a CLIA. We got them a CLIA waiver so that they could do on-site, on-demand antigen tests if we had anybody that came up symptomatic during the sessions. We did daily temperature checks before breakfast. We got a cool standing thing where the kids would just walk into breakfast. They'd get their hand sanitizer from underneath it, and then it would pop a little laser on their forehead and tell them their temperature. And the kids thought it was fun, so that was kind of cool. Daily symptom monitoring, and then we would have had contact tracing done if we had any positive tests during or after camp. And again, that would have been done by the Department of Health. We limited at-camp exposure through distancing, through a couple different mechanisms. There was distancing. So we decreased our capacity to allow distancing in the sleeping cabins. We only had 8 people per cabin, and we slept headsy-toesies and up and down on bunks. We had some great diagrams that we drew and mapped out and measured to see, and then we marked the bunks so people would know where they could sleep and where their heads went. We staggered check-in times for both campers and staff. We had drive-through camper check-in and check-out, which Ryan also mentioned, and that is a beautiful, beautiful thing. We actually put we bought used sheets from thrift stores, and we tacked them up on the sleeping bunks so that each bunk was like its own little self-contained thing. So as the kids were sleeping, they're in their own like COVID zone, or snot zone, whatever you want to call it. Outdoor dining in a tent with the table spaced 6 feet apart. Some of this is a rerun. We had pods. So the cabins participated in activities in cohorts or pods. One cabin would be no more than 16 people, or 2 cabins. And that was either, 10 kids and 6 staff, or 12 kids and 4 staff. And that was the only time they could have their masks off, really. The pods were used for, that was when they were sleeping, eating, swimming, showering, or bathing. We would have a max of one pod in the pool at one time. We scheduled shower and bathing times. We didn't have, our cabins don't have sinks or anything. So we just, we scheduled when each cabin would go to bathe. And then each cabin got a 2-gallon water jug, so they would brush their teeth outside the cabin. And then we distanced at least 6 feet between the pods. Ppe and cleaning, again, this wasn't like the bigger emphasis. The cleaning piece wasn't, but PPE was huge. Masking was huge. Everybody wore a mask, whether you're vaccinated or not. We wanted to feel like it's a community and like everybody's in this together, except when they're inside their own cabin or away from other pods. We limited deliveries and visitors, and we did ask them and require them to mask and distance. And we would remind people if they weren't doing what we needed. Hand sanitizer was everywhere. We encouraged hand sanitizing. We did clean the high touch surfaces and minimize shared items, but we did have some of those. The post-camp surveillance, and I think this is the big piece too, is our medical director asked everyone to, so that we talked about this during camp, and then after camp, we reminded people report any symptoms they had within 14 days after camp, their session ended, get tested, and then tell us the test results. So I think she had a couple of people that came back with, you know, they had some cold symptoms going on, they got tested, they were negative. So each session could really only be cleared as COVID-free after the end of that 14-day period. Just looking back and debriefing 2 months out from this, I would say that our camp planning and prep took 1.5 to 2 times more time than usual on the part of me and the program staff and the medical staff. I think it was harder than usual. There was a lot of uncertainty. Everyone needed more support before camp. Some of that just may have been, you know, we hadn't run in-person camp in 2 years. So it was like we had to learn everything again. The testing stressed some people out. We had a few volunteers that dropped just because they couldn't figure out how to get tested. We had 1 or 2 families that were like, we can't deal with the testing. We also had one family that said, we don't believe these precautions are necessary. We will send our kids to virtual camp. And that's their prerogative. It was nerve-wracking waiting for 2 weeks after camp to see what had happened. I'm like, Jamie, did we clear? Did we clear? And it was a good way to learn patience, but I don't think I did. As Ryan said, it was extremely rewarding. We all missed being together in 2020. Our families and campers were just so grateful to be there. And we've gotten a lot of great feedback from that. And I think the staff team was also very close from all their work together. There's a picture of us with our masks on in our photo. And that was like a get together quickly and then disperse. And that's it. That's the end of my thing. So questions in the chat, Jen?
I think Jamie addressed them. Are there any others? Great job.
So you had no positive tests, nothing, you had no positive COVID after camp? Nothing was...
Not as a result of our camp session, no. Somebody asked how many campers per session. So we did reduce our capacity. Normally our Kids Week session could be as big as 120 campers. We did, this year, I think we capped it at 65. Teen Week could be as big as 100 campers. That was capped at about 70. And then the day camp and Hobie Juniors combined would usually be around 30 or 40 campers. And that was about the same. It's a smaller camp, so we don't have to limit capacity as much. Sorry, that wasn't your question, Deb. That was just in the chat.
Yeah, that's okay. And did you do family camp?
We don't run family camp, no.
You don't run family camp. Ryan, in your family camp, did every family have their own cabin? Yeah.
Yes.
Okay.
Yep.
Okay. All right. If any other questions for Chris, we're going to move on and hear from Melissa.
Okay, so I'm just going to almost say just ditto, except for the bathing and the showering and brushing teeth. We just told them not to do any of that. You're at camp, you don't have to shower. Okay, I'm kidding. We did shower, we did brush our teeth, and we did all the same things. You know, we scheduled it. And for us though, ours is, again, as we all know, each camp that belongs to this wonderful organization, we're all unicorns and everyone's is different, right? So we use a camp that's not ours, and so we only have 1 week a year that's ours, and we I would say rent, but they donate it to us for the week, but it's a rental property, I would say. And in order to get our numbers where we could safely house them, we split our camp number in half, and then we split the week in half. So Sunday, Monday, Tuesday, Wednesday, we had our 7 to 13-year-olds, and Wednesday, Thursday, Friday, Saturday, we had our 15 to 18-year-olds, and we went up a year in age to allow those that missed 2020 that would have graduated the opportunity to come to camp, because they didn't miss it because they went to Disney World instead. They missed it because we had to shut down. So all of them wanted to come back and graduate with us. So that was pretty cool, and it was great to have them back and that opportunity for us to do that. As you'll see, my little slide, this is what we have. We did our full camp picture with a drone so that we could truly spread out. That one picture though is just of our older kids. Our younger kids, I didn't put that picture on there, but and then the top right-hand picture is our opening campfire, and you can see we too operated in pods. Kept our cohort group, and we had these great, fun reminder signs all over camp. There were some that said, Arapahoe loves to wash our hands, and just reminder signs that were festive and fun. And our goal was not to have to keep reminding of rules. Like Ryan, you said that you were surprised at how easily everybody wore their masks. We barely ever had to remind anybody to wear a mask. So our goal was to secretly have an abundance of rules where they still felt like they were at camp. So just like all that you've already heard, and we had all those same rules, but we made and just like y'all did, and we made sure that it was kind of, let me find it. Our motto, we created an environment where social distancing made sense, where, we didn't have an activity where they walked up and said, oh, we have to step here. When they walked in, it was ready for them. We also did the drive-in, in and out, checking in and out for staff and for campers, and we will never change that again unless a whole new worldwide thing makes us decide there needs to be a change. But that drive-in, drive-out by far has changed our lives for the better, and we're sticking with that going forward. We did it for Sibling Day last year, Camp Week this year, and we have a Sibling Day and a fishing day coming up, and we're going to do the same thing. Parents, families, siblings, they don't get out of the car. It's just the camper that gets out. So we're gonna continue that. But so those are, like I said, we're all three of us are going to basically have said the same thing. So I don't want to overdo that. But some of the things that we did do that were different is on our campsite, we had the main, I cannot pronounce the doctor, what she does, but she's over a pandemic. So whatever that doctor is, anyway, she actually came out for Baldwin County. For Mobile County, she actually came out to our camp and walked through with us how we needed to get our meals, how she wanted to see how we were going to do all that. And she okayed everything that we showed her we were going to do. We had one way in to the dining hall, one way out. We're always outside. We eat every single meal outside, but still how we went in and how we came out. But she came out and actually did a walkthrough to kind of approve us being there. We also, of course, met with our local physicians, our infectious disease doctors, all that. We met with them a lot prior to, and we followed all the rules that ACA recommended, that CDC recommended, plus, just like Chris said and Ryan said, we added to. And the kids didn't even notice it. They didn't care. They were great with whatever we gave them because we made it look like it was supposed to be that way, like that we'd always done it. We didn't draw attention to any of it in a negative or a way. We wanted to make sure that we weren't taking the fun out of it. We had a deep sea fishing trip scheduled. We do it every year. We were supposed to go in September, but as we all know, things are creeping up, especially around here. It's pretty tough. And we knew we couldn't get them to keep away from each other when you're fishing, because you're going to have help with the fishing, literally with the fishing pole. And the kids love to be inside the cabin of the huge, 60-foot boats. They want to climb on the bunk beds down at the bottom. And so we felt like our whole trip would be, don't do that, stop doing that, come stand here, put your mask back on, you're too close. And it felt like we were only going to be taking, we would be taking the fun out of it. So now we're doing a fishing tournament at camp. First time we've ever done it, where we can control the setting. It'll be our volunteers. You know, when you go on a deep sea fishing trip, you have deckhands and you have captains and you have amazing people because the trip's donated to us. However, we don't control them. We don't know that they'll keep a mask on. We don't know, you know, so instead of doing something that would not create a perfect environment for fun, we're changing it so that we are still going to provide a fishing event, and I think they'll love it. We had a different thing we had a little bit was for the cleaning, we had two of our staff members that were going to be second half counselors come first half, and they were what we called the clean team dream team, and they dressed up crazy and they had all the sanitizing and stuff. So they literally every hour were cleaning the community bathhouse or the dining hall or wherever they were cleaning. They went into each bathroom once an hour. They had a schedule, but they made it hilarious and fun. And then we swapped when we swapped midweek, and they became counselors, and two of the people that were counselors first half, then they became the clean team. So we had that, you know, that we implemented, and they loved it. It was surprising to ask people, will you mind just sanitizing bathrooms all day? And they're like, no, we get to be at camp. We want to stay all week. If that means we get to stay all week, I'll clean bathrooms. That's how much, Chris, you and Ryan are right. They wanted to be there. Our counselors, our staff, they needed to be there. And then we did midweek on Wednesday. Most of the staff left. We did have a turnover in staff for the second week. And the reason we did send some counselors home and bring some new ones in is because we need our counselors going forward. So for sustainability purposes, we needed to let the counselors that are usually with our teens, be with the teens, be there to help graduate them, but also be their counselors. Because some of them, you know, they've known for 10 years and it's time for them to graduate. So we needed that for sustainability as well. But we basically shut camp down for about 6 hours so we could do full sanitizing, where the Camp Gray staff came in and cleaned everything. But we also did PCR testing again for everyone who was staying. So we retested the big test. So we had to have that good 3-hour window to get the big testing done, and we had a false positive, but we had our protocols in place. We knew exactly what to do because we had a quarantine cabin and we put them there, including anybody that, you know, fortunately he only lived with another counselor because he was one of our lifeguards, so he didn't live with campers. So we were able to kind of shut them down. We had our protocol. Bless their hearts, we put their food on the porch and ran, you know, like we made it work. But he ended up being retested. They came right out to camp, tested him again, took it straight back into Mobile to the testing site, to the result site. While they were doing that, a lightning storm came through Mobile and knocked their power out. So what should have been a 3-hour turnaround turned into 6-hour wait. So our second half campers coming in, the parents had to wait to check in, and not one of them left. We sent through our app, we sent them a text and said, due to COVID protocols, we have a delay. You know, please, you know, we will let you know when to come, but please expect at least, you know, a 2-hour delay. And we have families driving 4 hours to get to camp, and not one of them left. They went, you know, I don't know what they did. We didn't ask, but they were, you know, they had to take care of themselves, but they knew that coming in, that there could be a delay. But all that being said, we got the positive, and then we just went right back to, I mean, we got it a negative. That's so hard to say. Ended up being, of course, negative, and we were able to go right back, you know, right back to camp, and it was just amazing. And then some of the things that we do want to carry forward, or things that we do that we aren't going to is like Chris, like you said, y'all did, and Ryan, you may have as well. We did all of our training online before anybody got to camp, and our new counselors suffered greatly from that. That is something that we won't do next year. We're going to do a lot of it online. We're going to still do some online, but we've got to get our new people acclimated camp. Like, you know, they were there, and 2 hours later, campers were there. They didn't even know where the bathhouses were yet. You know, it just was so overwhelming. Now, of course, we paired our new people with seasoned, amazing counselors, but those seasoned, amazing counselors had gone to work. They were there. They knew they had to get ready. They had to get the cabins ready. I felt so sorry for new volunteers. I know they felt like they were just thrown under the bus, but oddly, 2 of them were the first people to sign up to help with siblings. So they understood this wasn't typical, and they're already registered to volunteer for the next event. So it worked, but you know, one thing we will definitely do is bring our new staff in for on-site training while keeping some of it online, because what we did appreciate or think we can do is spend more time with the counselors, getting to know each other, you know, like becoming a little family prior to their campers getting there. So trying to find that balance is something I think we'll all be doing. We will also limit visitors. We did for COVID. In fact, there were 0 visitors. No one walked on camp unless they were already PCR tested and that they were already staying with us. There was no deliveries. There was no nothing. And now there were deliveries, but nobody came in. We had a covered trolley. We went to the gate. It was contactless. So there was no contact with anybody bringing a meal. And we're going to do our best to limit that or find a way to scale that back, because the kitchen staff, the arts and crafts staff, the programming staff was like, it was so much better not having to entertain the visitors. If somebody, you know, you have a company that donates a meal, and part of the dining hall's attention is spent entertaining them. That didn't happen this year. They got to solely focus on actually being at camp, and they got to spend more time with the kids because they weren't entertaining visitors. So we are going to try to, again, find that great balance of sustainability, where you want these people to come in and be loved on, and you want to do that because of such generous donations, but at the same time, at what cost when you're limiting your time with your campers and your staff is being pulled to entertain. So finding that balance. And so those are some things we're definitely gonna try to keep going forward. So that's kind of it, because so much of it is the same, but I'm happy to answer questions. And it was just me from my camp tonight, so I didn't even read any of those, Jennifer, I'm sorry.
That's all right. Yeah. There's a couple of questions in the chat. Let's see if I miss any, somebody shout out. Let's see.
While you're looking, Jennifer, can I make a comment?
Yes, please. Hey,
so
Tracy.
I'm Tracy Gaslin. I'm with the Association of Camp Nursing, and you all make my heart sing listening to your stories, because you're doing exactly what we ask everybody to do this summer. And we are heavy into COVID research, doing all the research following camp now. I literally have an interview here in about 10 minutes. We're doing multiple interviews, quantitative surveys, looking at, I have about 16,000 health log entries we're looking at to see what camps we're documenting this summer. So we're doing, again, another robust approach to looking at what the great work you guys did this summer. So when you say I have a communicable disease plan, like my heart flutters and I have palpitations, it makes me so excited. So we've worked hard to get everybody in the right place. So it's just great to hear your stories, and I thank you for sharing that. I will tell you that we are working on vigorously on vaccine hesitancy information, vaccine booster information, COVID variant information, mental health, because we know that was a major issue this summer, new testing cadence patterns, working on parent preparation documents. So all those things y'all doing really great, and we're hoping to kind of continue to help you build on that moving into 2022. So I just want you to know there's more coming, and it's certainly going to be helpful to kind of build off the great work you're already doing. So thank you. This is fabulous.
Thank you, Tracy. We appreciate you very much. Any questions for Melissa? I didn't see anything specific from Melissa, but if there was, please just ask away.
I see where Tracy, you asked about separating siblings. If that was for me, our siblings don't come to camp. We have a separate sibling weekend. So yeah, so no, there was no hesitation or anything, because they don't do our camp week. It's a separate one.
Okay. There's a question for Tracy. Earlier in the pandemic, there was information about when was the best time to test against COVID to avoid false negatives, because essentially tested too soon. Is that timeline different for the Delta variant? Good question.
That's a fabulous question, and we are actively looking at that. So I'm working directly with the CDC. I'm involved to their task force. So what I'm doing is gathering research and data, handing that off to them so they can open schools. And then I get to capture school data to feed back to camps to help us open camps safely. So I'm very hopeful that we will have more information about that testing cadence relationship with the Delta variant, because we are continuing just to treat it as we did the typical COVID, right? And now we're not sure, but I mean that we know that there are breakthrough cases of people testing positive who have been vaccinated, but the timeline is still something we're pulling data together on. But that's a great question. Hopefully we'll have that for you very soon.
Awesome. You guys rocked it. I'm just so proud and so impressed, and you guys are, you know, models for the rest of our members within COCA to be able to plan, prepare, and pull off successful camps without COVID. So I appreciate each of you coming on tonight, sharing your stories from this summer. And if there aren't any other questions, I think we'll wrap it up.
Well, I'm just grateful that for all the people who are here tonight, because when, you know, Jennifer and Don try to set things up, you just don't know how it's going to go. But this is exciting to see this many people wanting to see how it worked and if it can work. And we have an event coming up in September, 2 events in September, and we've already made changes based on what we did this summer to make it work. So it can be done. And just like Chris and Ryan said, this was the hardest in 21 years I've ever worked, and it was the most satisfying week of my career. I mean that for everyone that was there, from the nurses and staff, you know, physician that was there, to you know, our bacon cooker who cooks bacon every morning. It literally was the most important week in my 21 years. And as hard as it was, I would do it again. Absolutely do it again.
I do want to say, to add to that, it was so rewarding. I underestimated what a 1 year gap, like what it would look like to have not done camp next summer. I mean, we ran programs, but virtual was very, very different. And going back to camp and like, oh yeah, what do we do on opening day? And what do we do on closing day? And yeah, like all these things, you think, oh yeah, it's been a while since I did that. So that I think as detailed as you can be in your, like having your standard operating procedures and like writing down, you know, we're trying now to label boxes as we put them away in the storage shed of take this box out first, so that we, you know, we make it really easy for ourselves for next time, because that's not something we did before.
Well, I'm impressed with Chris and your community health providers. I called the county health department that I'm in, and they were really not helpful at all. They were like, I wouldn't bother with the antigen test, too many false negatives, false positives. You don't need to do this, you don't need to do that. They really didn't have any input for our camp. So
ours was just the opposite. They didn't want us to go, but if you go, you have to do this, this, and this. So we did this, this, and this so that we could go, and it works. I'm so sorry, Beverly. That's that.
Well, Arizona is kind of like survival of the fittest, I think.
Yeah.
Any other questions, comments? Yeah, like fireworks.
Thank you.
Thank you guys for joining tonight. It's great to see all of you. We really appreciate you. We give you kudos for virtual and in-person programs this summer. That is just a huge thing that you have planned and pulled off. So congratulations and thank you guys. We love you and we hope to see you at a future session. Thanks for joining.
Thanks, everyone.
Thank you.
So thanks y'all for joining us this morning. Last week, we had a really great session for our COCA members that was titled Celebrating COVID-Free Camp. And I just wanted to take a couple of minutes and ask you guys a couple of questions. After our session, you guys just shared a lot of really good information that I think our other camps could glean from. So you told us in your own words, you know, it was your in-person camp this summer was truly the highlight of your career within pediatric oncology camping. And I would love to hear from each of you in your own words, you know, what was that highlight for you? And we'll start with Ryan and then Chris and Melissa, you can chime in. And I would love when you tell us your highlight, your key takeaways from this summer.
Sure. So my highlight happened on the last night. So we went through 26 days of camp and we still had our prom. It was still cohorted and everything on the last night. And then the kids who are aging out normally get the microphone and say what camp meant to them. And then the counselors will go around and speak. And I closed it out. And after the entire night was over, I just got on the microphone and I said, ladies and gentlemen, we did it. And it was like we just won Game 7 of the World Series. Everybody was crying. Everybody was hugging. I'm getting goosebumps all over again. I was a wreck. I was crying. And I think it was a result of the fact that it took everyone. It took our full-time staff, our volunteers, our counselors all had to sacrifice. Our families had to be involved, and I never had to be so detail-oriented with them. So it was the sense of community and the sense of accomplishment that we all felt that really is what I'll remember for the rest of my life.
I guess I would just echo what Ryan said, that it really was a team effort. I mean, obviously, you know, from the medical standpoint, my medical director had extra stuff she had to do to make this really happen well, and the med staff had to pitch in. But we had, I was training 4 new staff people for our organization this year, and that was daunting as well to be doing that in the middle of all this. But what I saw during our COVID planning was that this group was really a group of people that they were all in this to make it great for the kids. And they're all in this to try and do things better and bigger and, you know, make it really wonderful. And to see that spirit through all of this, I think, you know, we've gone through a couple of very difficult, hard years, and to see people come together that way is truly heartwarming. I think there's a bond that you get with your team from going through something like that. And I think that's what made it so rewarding. And that's on top of, like, camp is my favorite place in the whole world already. So to make camp even more camp was like, can you even do that?
Yeah, and for me, you know, we always love our staff. We think they do a great job, but it was humbling to watch, you know, my paid staff. There's 3 of us, and to watch the other 2 from them down to the brand new camper in family, we went not down to, but you know what I mean. We went from looks of frustration and disappointment to relief, to then filled with joy, to then filled with hope. And that's what we are all about, all of this. But to see that, that look of shoulders being lifted and the smiles back, and the relief and the joy, I think was immeasurable. And that was for 100% of the participants across the board. And you don't get that every year. You know, you don't get that every camp week. Sometimes the frustration stays, but the level of frustration we've been living with for several years now, and disappointment, was quickly changed when the first camper family that drove to camp and went through our new process, didn't balk, didn't blink an eye. They were there, and that level of joy that we all got to not just see but feel is what I think will sustain us through this next set of changes, whether they're good changes or bad changes. I think we got to be, our cups were filled back up because we've been pouring it out so long. And I just think that's what was beneficial, as much as anything, was seeing what it did for my staff.
That's awesome. Next year, I know it's hard to think about 2022 summer, but have you guys thought about how your success from this summer will be a catalyst that will, you know, move you forward next year and keep you successful? How do you see that kind of carrying you into next year?
Yeah, so we're planning for the best because we're already prepared for the worst after going through this year. So we are planning on hosting a normal year of camp. We have our normal dates and our normal policies, obviously knowing that that's more than likely going to change. But because we have this plan, we feel like we can keep adding layers to it as we go along, which kind of might seem counterintuitive, but that's, you know, that's how we're looking at it. We're optimistic, but prepared to host another summer like this if we had to.
Yeah, again, I feel like I'm repeating. You know, I think there was quite a bit of things that we learned this year from how we had to adjust our practices to run camp in the middle of a pandemic. And there are things that we have talked about at post-camp that, you know, we had the debrief with the staff where we said, so what do we keep and what do we not keep? And, you know, the things we want to keep are check-in and drive-through, parent check-in and check-out. Yeah. We want to keep the hand sanitizer stations all over. We like the daily temp checks. I mean, there were just things that, like, almost most years at camp, we have some little run of somebody gets a GI tummy ache and then everybody in their cabin has it, or, you know, I mean, even though we're practicing good hygiene and all that, there's some little bug thing that comes up, and it's just part of being around other people. And with increased hand washing and, you know, meds, like people wearing masks, that wasn't there. And while we don't want everybody to wear masks, you know, my medical director said, you know, my med staff should wear masks when they're doing exams on kids that come in with stomach issues. And it's one of those things that, you know, they're medical people, but we all had that moment, that aha moment of like, why did we never think of this again? You know, people really liked eating outside, and we'll work through what's possible with that. You know, we realized that our campsite that we lease, they didn't like our tent. And so the tent is not going to happen again. So we have to figure out another way to do that. But we're thinking about other ways that we can do outdoor dining with our population, and we'll figure it out, and we'll keep working on that.
Yeah, pretty much the same, the good things. It's interesting how all of a sudden we're like, well, we should be washing our hands more. That's kind of not new, but it is something that it was a good reminder. It was a tragic reminder, but a good reminder of just, you know, basics about, you know, taking care of each other, making sure that everything that we've always had in place is actually in place and happening. And so, one of the other things we noticed was how sometimes we overwork on some things and scaling back on a few things, like changing our schedule so that there are less people at each activity. That is a good thing. Well, we always were trying to pile everybody together, while we will still do our best to get back to all camp activities. Some of our our daily activities, a smaller number is easier to work with. You can maybe actually get a different project that you've always thought, well, there's too many at a time to do that. Well, now we can, because we're going to have, a few less people. So there are some great changes, but also just amping up what we've always known to do. We just need to make sure we're doing it. And this has been a great reminder.
So Chris, I just want to echo what you said about the parent drop-off driving in and just throwing their bags in the car when they left. Was incredible. We'll do that forever now. I never had to communicate so much with the parents before camp. They must have had a list of 20 things that they had to do, and if they missed one, they couldn't come. So we had a lot of parent meetings that I'm definitely going to keep, because they were more prepared for the normal camping side. Cohorted activities, I thought I was going to hate it, because our kids typically do free choice, but we're definitely keeping some aspect of that next year. And I told Dawn the other day on the phone, since all of our activities were cohorted this year, we had one item of lost and found the entire summer.
Yes, none.
It was incredible. So the kids would leave, and if there was something left behind, the next cabin would know who it belongs to. So that was just one quirky thing that came out of this year that I think we're going to be keeping from now on.
Going back to the parent drop-off, I think this was probably mentioned. I know for our families who are very familiar with camp, parent drop-off looks very different for them versus a new family. How did you guys, prevent that new mom or dad from lingering at camp? I know it was very strict. I mean, they didn't even get out of their car probably, but how did you communicate different with those families about parent drop off? I know, it's important for parents to see where their child sleeps and where they eat and meet the medical staff sometime. Of course, if they have meds, they're going to check in at the med shed or the health hut, but did you have to communicate different with those new families?
Well, one thing to think about is new families have no idea that it's different. That is how it looked to them. It wasn't strange. My main communication every year is with new families. So I walked through the check-in process with them anyway. I do that every year. I talk to all the new parents. Our old parents, we have the same conversation about check-ins going to look different, but everything has looked different for them in the past, 2 years or almost 2 years. So it wasn't crazy. What it did help us with was social distancing, because the first thing we usually do with our returning campers is I'm hugging the mamas and the daddies and the well, we needed not to do that. So keeping them in the car set us up for success on that because the barrier was already there. But yes, we had the conversation, y'all, it's going to look different. But actually, our returners liked it because it was so much faster, because they did the full medical check-in in the car, with the parents. They did temperature check, they did blood pressure, they did everything, right there. We had a doctor's tent set up where if they needed an additional type of, we had what we called a fast pass line and a longer line. And so kids that did not need to do anything but a quick wellness check, basically, their parents were in and out of drop off in like 20 minutes, and we're celebrating it. The families that needed longer, they were not in the fast pass line. And they expected that. But also my med shed staff had talked to every single parent who were bringing, any child on treatment before they got there, but then had the same conversation with them, again. So again, the new parents don't know the difference. So there was no like, we're so sorry. They don't know that, right? And our returning parents, again, are used to seeing us and we get to love on them, but they also have had to send 5-year-olds into kindergarten for the first time without going in the room. So it ended up being normal, really. And what we felt overarching was it felt a lot safer, because when we're doing check-in, typically, even though we have where you're supposed to park, kids are excited, they're running, people are everywhere. It just felt safer that there weren't extra bodies running around, that the golf cart people had to watch out for, that somebody backing out because they were through with checkout had to look for. It was just safer all the way around. You didn't miss a child who slipped through somehow and missed the whole med shed stop. That wasn't possible. So overall, it was safer. And they didn't miss the fun. I mean, they just wanted to be there, you know, so that's what
I would agree with Melissa. And even, you know, we heard from our returning families that they thought it went more quickly and that they thought it was better. You know, in the past, they would come into the lodge and they would wait in lines in the lodge, and you'd have, you know, this big crowd of people standing there waiting their turn. Mm-hmm. When they're in their car, they've got their music, they've got their drinks, they've got their air conditioning on. It's like, it's their zone. They're comfortable. They aren't anxious. They aren't, you know, they don't feel like people shoved into a tiny box that are struggling for their own personal space. So it was better. And I think it's safer. I think that's what we keep for going forward, is that this is safer for your kids. It helps your kids adjust better because, you know, yeah, if there's a big homesick problem, then we will work with you on it to help that kid feel comfortable. But I still firmly believe that the largest predictor of a kid being homesick is a parent being clingy. Mm-hmm. And nothing that we did this year changed that.
Yeah, so we had an open house for new families this year where we walked them around and everybody was masked and everything. And that really helped because they got to see the facility. I also hosted 2 virtual open houses for new parents so that they can hear me and hear the procedures from my mouth. And then I think the best thing that we did beforehand was our camp nurse called every family and had the medical conversation with them before they even got to camp. Because, you know, you're always going to have those moms or dads that stay there and they want to describe the entire health history for an hour. So they were able to do that privately, and that made our health screening go way faster than a typical year.
Can I ask you a quick question? When you were doing the in-car health screening and taking temperatures, did you also take the temperatures of the moms and the dads or whoever else? It was just strictly the campers then?
For us, yes.
Ryan, same thing?
Yep.
Chris? Okay.
We did just the campers, but they had to fill out we made them fill out a little form of whether anybody in their car had a fever or anything. And then we also had the COVID testing, right? So that was the first step in check-in. They pulled in, well, before they even got into the campsite, they got handed their screening form to fill out for their car. Then they pulled up to the COVID testing tent and their campers got nose swabbed. Then they went and talked to the medical staff, and we had, 3 or 4 tables of medical staff. And then, like Melissa said, there was a fast pass line and a not fast pass lines. We called it your kid has medications or your kid has no meds. And they would, pick whichever line was most suitable for anyone in their family, and then go through that. And then they would check in with the admin staff just to make sure that we had all their forms and things figured out. And then the last step they would pull forward to is where they'd actually wait for their COVID test to come back. And so we might have a couple cars sitting, but by the time they got around to that last station, the test came back like within 10, 15 minutes for the most part. So most of the time, by the time they got there, we would have a runner coming over from the testing station with their results. And we did, like on each car, we printed a little sheet with their last name and we put it under their windshield, like as they entered the campsite. So the runners could actually see which family it was when they pulled up at that last station. And the last station was, once the runners came and said, your tests are negative, then we had staff there that could unload the kids' bags and they would run the kids and the bags up to the cabin. And then the parents left the campsite.
Great process. Last question. We are on the heels of September, and we know that many more of our member camps would love to hold in-person programs this fall. And I know some of you probably have some events coming up in September and October. You know, what advice would you give to our other members who are planning on attempting their first in-person events, whether it's overnight or one-day programs or activities? Ryan?
So the easiest way to prevent an outbreak at camp is to prevent it from ever entering camp. So I cannot recommend enough testing. I don't think you can test too much. We tested all of our fully vaccinated staff. We tested everybody, regardless of vaccination status, and especially with the Delta variant, I can't recommend doing that enough. And we bubbled. So I didn't leave camp for 9 weeks this year. I would go to the top of the driveway and stare longingly out at the main road. And I'm fully vaccinated, and I was tested at least 10 times this summer. And especially with the Delta variant now and people who are vaccinated testing positive more frequently, that's something that I cannot stress enough.
I would agree with Ryan. I mean, I would also advise people that are thinking about this to be very clear about what their criteria are for when they can and can't do this. Like if you're in a state that has low vaccination uptake for your staff, that I would really look at that, you know, because if your staff aren't vaccinated, your risk of anybody getting this and spreading it are going to be higher, and especially with Delta. So I would make sure that you're really talking closely with infectious disease and looking at the case counts locally, and you know, what's your percentage of kids that are getting sick too, because Delta has been shown kids are more likely to get this and to get seriously ill from it. So I mean, I think that where we were in June, we literally hit the 2 weeks of the summer that we met all of our cut points. Those were the only 2 weeks that we met the criteria that we'd set with our infectious disease people. So it's a different picture right now. And doesn't mean you can't do it. It just means be very thoughtful about it.
And for me, on the practical side, or the actual being on site for an event, these are the things that I would consider a lot. Keep a deadline. Once you've set a deadline that you have to be registered by this date, don't budge, because in planning for social distancing or for an activity, you need to know that it'll be no more than this, but it could be less. I would add staff, not take away staff, because they're going to drop out at the last minute for multiple reasons, because we just went from a weekend event to just a day event, and those of our staff that were traveling out of town for a weekend aren't going to travel just for a day. So, because there's nowhere for them to stay, right? Because we're not going to be there for the weekend. So you're going to lose staff. So bump up your staff. Don't take down your staff. But also when you're planning, take all that down a notch. Keep your extra activities in your pocket, you know, that we learn at COCA all the time, have those pocket games, whatever. But everything you plan, take it down a little bit. They just want to be there. Your staff just want to be there. They just want to be together. So don't over plan, because your planning right now is COVID related. Your planning is how can we get them there safely? You need to be very freed up from, do we have enough glow sticks? Do we have, take it all down. If you've got a lake, let them fish. If you've got a lake, let them swim. Don't work so diligently and hard on stuff, because our focus needs to be on safe fun for now. And so that's what I would recommend, is every activity, pare it down. Instead of going deep sea fishing this year, which we usually get to do, because we didn't think we could control what was happening in the boat, because they're too excited and they want to go downstairs and climb on the bunk beds. Well, we can't do that. So we're having it at camp, and we're just going fishing. But we're just fishing. We are fishing, having lunch, and going home. We're not adding in the gaga ball. We're not adding in arts and crafts. So we literally are there for a fishing event, and they will love every minute because they're just together. So scale down everything so that you can focus on the fun being safe. That would be my recommendation.
And I just want to echo what Melissa just said, to dumb it down and just use common sense. So it's really easy to get caught up when you're planning on getting all these buzzwords, cohorting and masking and everything. And it's like your head will start to spin. So just dumb it down to a common sense. Is what they're doing right now safe? Is there a chance that they would transmit it easily, that type of thing? And when you actually dumb it down and look at its core, cohorting doesn't seem as scary, or choosing when to mask doesn't seem as scary. So rely on your common sense, really.
I have one last question. First of all, I want to thank you all so much for this. This is over the top, wonderful. The same night of the webinar, I got a call from a camp director, and he said, "Don," he said, "when is this recording going to be available?" Right? And I said, "Well, you know, we'll try to get it out." He says, "Well, let me know because we've been struggling with deciding how to do a camp." He said, "But I want to make sure that my camp staff, the medical staff, and everything else see this because it's that important," right? So I have one question. This is a deer in the headlights kind of a question because there's no real answer for it. But if you had to leave our members with that one thought when they're thinking about camp, thinking about all the challenges, with that one thought that you really think really exemplifies what your experience was this year, I guess I'd challenge you to put that into a one sentence or two sentences. So is that fair? It's probably not, but I'm going to ask it anyways. So, Chris?
I would say ask for help. I mean, ask everybody you know for help. Ask people from your camp for help. Ask your board for help. Give out. There's so many parts, and it's a big moving machine. So get people to help with all of it. You don't have to do it yourself. Ask people from COCA for help.
You got it. Brian, you got any thoughts on that?
Yeah, definitely ask for help. There's so many resources out there now. But for me, it comes down to you can do this. It is possible. We're all smart in COCA. We're all a community, so let's rely on each other. You can do this. Your parents, your families, your campers, your staff, they need it. There is a big need right now. And I say, if you're on the fence about it, reach out to any of us, and I'm sure we'll give you a lot of positive feedback that you should do it, you could do it, and that I'm telling you, after this year, your parents, they'll thank you for the rest of their lives.
Mm-hmm. And I would say, because of what both of those two just said, we've got so many things in place that are awesome that we need to trust that. We need to trust the medical team that you have in place. You need to trust the public officials that have helped, you know, I know that's a hard thing maybe to hear sometimes, but if there are rules for masking, trust that, be there, just trust your educational process. And when you're there, do your best to be there. Of course, watch for safety. We already do that, right? Your raised level of watching for safety, but be there. Immerse yourself in the camp experience, because it's very, very important as administrators to be a part of the joy we're bringing, and not just not just the administrative side, but immerse yourself, be there, and see that not only was it successful for them, but it was for you. And I think it's really important that we remember to take care of ourselves, and that will do that if you'll immerse yourself while you're there.
Awesome. And I would just add to that too and say, that's your reward for all the hard stuff that you did all year long, is to be there and see the kids and the staff and see what happens.
You know, camp is more than a t-shirt. It's more than a t-shirt. So
it truly is. It's a community, and you guys truly proved that this summer with everything that you accomplished, from working so hard with your volunteer and paid staff and your medical staff. You guys, great job on the community that you built within your own organization and your families. And Thank you so much for sharing with us today about your successes of a COVID-free camp this summer. Thank you.
Thank you.
Thank you.
Thanks, guys. Thanks so much.
Man, that was awesome.